today we are going to take a new topic which is again a commonly asked question. 10-15 मार्क के लिए तो ये पूछा ही जाता है कई बार. It's wound and its management or injuries and its management. Scope and limitation भी पूछते हैं. What is scope of homeopathy in wounds? What is scope of homeopathy in injuries? Well, I am not currently going to elaborate on wounds and everything about that, or about injuries and everything about that, but I'm just going to jump over what is your scope of homeopathy in wounds, scope of homeopathy in injuries and the theraps. But before that थोड़ा मैंडेटरी है. अगर 15 मार्क का क्वेश्चन आता है लिख के कि एक्सप्लेन वूंड्स एंड इट्स मैनेजमेंट, तो आपको क्या क्या पॉइंट्स इंक्लूड करने हैं. ठीक है, आई होप आपको पता है व्हाट इज इंजुरी एंड व्हाट इज वूंड. दोनों में डिफरेंस है, अच्छा खासा डिफरेंस है. अगर वो डिफरेंस नहीं पता है तो प्लीज देख लीजिए, पढ़ लीजिए एक बार. इट्स अ बिग डिफरेंस. अदरवाइज scratch your brains now and write in comments what is the definition of wounds and what is the definition of injuries. So well, injuries basically is nothing else than a physical trauma caused to a biological organism from outside. That's injury. Okay, so now this injury could be anything. This injury could be your renal injury, your hepatic injury. It is a trauma caused to the biological organism, right? But wound is a trauma which is specifically caused externally, resulting in damage to the skin, because it could be tearing of skin, it could be laceration, it could be avulsion of the skin, or it could cause any blunt trauma or open trauma, as in खून निकलेगा, it is torn, it is lacerated, it is inside. So that's a basic raw differentiation between what is an injury and what is a wound. So therefore your scope and limitation in injury and wound is also going to be different. क्लासिफिकेशन आपको वुंड का याद रखना है, वो क्लासिफिकेशन में ही आपका स्कोप डिपेंड है. So now there are two classifications of wound, right? The first classification will tell you how is basically the wound, right? मतलब ये open wound, ये clean wound है, ये contaminated wound है, ये infected wound है, या ये colonized. That is the first classification, right? And the second classification is it an open wound or a closed wound? तो अगर ये open wound है, is it an avulsion, abrasion, laceration, punctured, gunshot wound, penetrating wound, or if it is in the close, is it internal trauma or external trauma, क्या क्या है इसको, राइट? सो नाउ ये क्लासिफिकेशन याद आने के बाद, मतलब याद रखने के बाद, आपको ये ना स्पेसिफिकली पॉइंट पॉइंट ब्रेक करके लिखना है आपका स्कोप कौन से इसमें अच्छा है, कौन से इसमें लिमिटेड है, कौन से इसमें अच्छा है, मतलब अच्छा है, लिमिटेड है, ये आपको लिखना है. और कहाँ पे बिल्कुल नहीं है स्कोप, ठीक है? सो ये स्कोप लिखते वक्त आपको ये ध्यान रखना है कि इन ब्रूसेस द स्कोप इज गुड, इन एब्रेशन द स्कोप इज गुड, इन एवल्यूशन इट इज वेरी लिमिटेड, इन पेनिट्रेटिंग वुंड्स अगर इट इज वेरी लिमिटेड, इन पंक्चर्ड वुंड्स अगर पंक्चर्ड मटेरियल इज रिमूव्ड आउट एंड इट इज स्मॉल, देन द स्कोप इज गुड इन केस दैट पार्ट वाज नॉट इन्फेक्टेड विद एनीथिंग एल्स. ठीक है? एंड देन यू सो ऑन एंड सो फॉर द स्कोप विल वेरी. सही है? यहाँ तक समझा है? सो नाउ आपको ये लिखते वक्त आपको और एक चीज़ ध्यान देनी है. हाउ इज अ वुंड? इज इट एब्सोल्युटली ओपन? इज इट इन्फेक्टेड? इज इट कॉलोनाइज्ड? कॉलोनाइज्ड वुंड में स्कोप लिमिटेड हो जाता है. इन्फेक्टेड वुंड में इट इज गुड. क्लीन वुंड में इट इज वेरी नाइस. कॉलोनाइज्ड वुंड में एज आई सेड इट इज लिमिटेड. ठीक है? मतलब द इम्यूनिटी इज कॉम्प्रोमाइज ना पेशेंट की. अगेन कंटेमिनेटेड वुंड में भी स्कोप इज गुड इफ यू क्लीन इट. यू हैव टू क्लीन. वो कंटेमिनेशन, सॉइलिंग वगैरह वो वैसे ही रख के यू कैन नॉट से द स्कोप इज गुड. इट्स नॉट हैपनिंग लाइक दैट. सो नाउ दिस बीइंग a dynamic thing happening, a wound, मतलब it is not a miasmatic thing, right? So the scope will depend upon again उसका पहले का presentation, दूसरा कितना vitality, कितना patient affected बाहर और भी हुआ है. बिकॉज अगर सिर्फ पैर पे लगा है तो ठीक है, बट पैर के साथ हेड इंजरी भी हुई है, वो कोमेटोस भी हुआ है वगैरह वगैरह, सो ऑन एंड सो फोर्थ, शॉक में गया है, देन द स्कोप विल बी लिमिटेड. ठीक है? सो ये भी एक याद रखना. देन वी कम टू द लिस्ट ऑफ थेरेप्स दैट वी हैव. So the list of theraps are many. I'm going to just discuss few drugs that we have in hand. So what are the few drugs? They are like arnica, calendula, Belisper, echinacea. You have Leadenpal, commonly asked and commonly given, and you have Belisper. ठीक है? And Hypericum. So these are the commonly used remedies and important drugs that you should not be missing out in writing Theraps. Then again, you have other drugs like Bryonia, you have Rustox, you have Hamamelis, you have Natrum Sulf Pyrogen in case if there is a lot of infection. And bleeding में phosphorus and Hamamelis के साथ you use with phosphorus. So we come to writing what are the points that you are going to include in Arnica. अभी आर्निका का वुंड कैसा रहेगा? It is going to be a closed trauma, blunt trauma. It is elements from injuries which are remote and of recent origin. याद है? It's given in Allen's keynotes. I hope you remember this. The Theraps के points आपको Allen's and Boric से ही उठाने हैं, preferably, right? It is of much help. So you will encounter that when you are writing Theraps for Arnica, these are the points that are even given over there. So after traumatic injuries, overuse of organs, strains, this remedy is predominantly used. Then for injuries, falls, blows, contusions or even septic conditions, मतलब वो injury is not managed at the right time and it turns septic. ठीक है, very painful soreness, इसीलिए patient will always have that sore, lame, bruised feeling when he lies on a part, because of which he feels so restless that mentally even if he is weak, he will want to move. मतलब he is prostrated completely but he is completely restless because वो चुभन इतनी होती है, वो aching इतना होता है. Secondly, this person will have wounds which show that ecchymotic appearance, blackish bluish discoloration with a lot of swelling and severe painful and tenderness to the extent that the patient will say हाथ मत लगाओ. ठीक है, ऐसा आर्निका वाला रहेगा. अगेन बेलिस्पर कैसा रहेगा? बेलिस्पर में भी ब्रूज सोनेस रहेगा. बेलिस्पर में भी कई बार ना आपको ये सब वीनस इकाइमोटिक अपीयरेंस मिलेंगी. However, this is not a very true trauma वाला रेमेडी, मतलब किसी ने मारने के बाद. इसमें आपको क्या दिखेगा? इसमें आपको हार्ड एकिंग, स्क्वीजिंग, थ्रॉबिंग पेन दिखेगा and along with the trauma or the injury or the pain that the patient is having, he will also have some complaints which are related to venous vascular system. मतलब वेरिकोसिटी होगा या समवेयर वीनस एंगॉर्जमेंट होगा या समवेयर पाइल्स ही पेशेंट को मिलेगा आपको. And therefore, because of that stasis, he will have that tired and fagged out feeling. Okay, deep trauma again, इसमें भी septic wounds and affections है. Post injury, I mean post surgery also pelvic traumas या pelvic surgeries के बाद इसे यूज करना बहुत excellent रहता है. It prevents further soreness which is likely to develop post operations. Excellent remedy for sprain and bruises. First remedy in injuries to deeper tissues after major surgical shocks or surgical works. Results in injuries of nerves which leads to intense soreness and intolerance to cold bathing. Okay, now यहाँ पे ये septic जो condition है, unlike आर्निका, यहाँ पे pus development भी हो जाता है and it is also used for as a remedy for old gardeners, मतलब या old laborers या people who are traveling continuously, overworking and overusing that particular part of the body. ठीक है, which might also lead to oxycodynia in certain cases. ठीक है, so that's arnica and belisper that we have differentiated. Second remedy in same synchronicity I would want to speak about is लीडम्पा. लीडम्पाल is also a remedy जहाँ पे आपको ये again blackish bluish discoloration मिलेगा, but it is a remedy जहाँ पे trauma के साथ साथ punctured wounds में भी it is used. Arnica is also used for lacerated wounds, mind you. ठीक है, so produced by sharp, this ledum is produced by sharp pointed instruments or bites. So bites that you will encounter of any rat वगैरह वगैरह, animals bites वगैरह. Particularly now in this condition, the wounded part will be very cold, which is not a feature that you encounter with arnica. And you also see ecchymosis, long discolorations after injuries which are aggravated in the night from heat of bed and better with cold, which is very PQRS now. Abhi patient ka part is cold to touch, but it's better with ice application, better with cold, which the modality was not a predominant thing which was seen in arnica, right? Now we come to the next remedy, which is Hypericum. Hypericum is a remedy which is used predominantly in cases जहाँ पे crush injuries हो जाते हैं. Crush injuries मतलब आपने ऐसी उंगली दरवाजे पे रखी है और दरवाजे के यहाँ पे आपका हाथ दब गया because the door banged on it. So that is one type of crush injury. So for crush injuries, you will often encounter the remedy which is hypericum, which is used because patient will complain of वो सुन हो जाता है, दुखता है, जैसे tingling tingling numbness होता है, especially for the end nerves. You have severe neuritis, severe pain, burning, soreness वगैरह रहेगा. And lacerated injuries में भी ये बहुत यूज होता है, mashed fingers जैसे मैंने कहा. Injury to or reflected from brain cord, मतलब the pain is that severe, it's very painful, sore parts. And as I said in यहाँ पे बेलिस्पर में कैसे कॉक्सिकोडाइनिया में यूज है, even hypericum you use because again it's a neurological condition, severe sensitive nerves, intolerably violent shooting pains, and they are lancinating, मतलब इससे करंट की तरह आते हैं, lancinating pains along the nerves towards the trunk, downside of the head, chest, in epigastrium. Interscapular spine also, fingertips also. Neuritis is an outcome of injury. So this could be secondary to your surgery. This could be secondary to, as I said, some smashing आपके दरवाजे के अंदर या कहीं कुछ वजन गिर गया आपके पैरों की उंगलियों पे या हाथों की उंगलियों पे, उसकी वजह से. It relieves pains after operations. Spinal anesthesia के टाइम पे, post spinal anesthesia, many patients do complain of back pain कि back pain is there, relief नहीं हो रहा है, surgery के बाद से वो back pain हो ही रहा है. Think about giving hypericum at that point of time. It relieves within few days. Intolerably violent shooting, lancinating pain along the nerves towards the trunk, as I said, and there's a lot of tingling, burning, pain and numbness. As again, it relieves the pains after operation, that is surgery. ठीक है. Then you have calendula as the next remedy. अभी मैंने क्या क्या कहा आपको, blunt trauma के लिए कहा. Blunt trauma के लिए you had arnica, you had Belispar, and you had ledum. These are pretty much blunt, though ledum you use in cases of lacerated also, punctured wounds, and arnica you use for lacerated wounds. सब में ब्लैक ब्लू डिस्कलरेशन मिला आपको. हाइपरिकम यू यूज्ड इन केसेस ऑफ नर्व इंजुरी, सीवियर न्यूराइटिस विद टिंगलिंग, नमनेस, विद lancinating pains. Now you come ahead to remedies which are having open wounds, that is calendula, and then we speak about echinacea. So calendula is one of the remedy where you use in case of lacerations जहाँ पे excessively torn, excessively painful feeling रहता है, and the wounds are open, torn. So ये clean incise होना ही necessarily always important नहीं है. Clean incise wound में भी you will use calendula definitely, but even if the wounds are jagged, completely ऐसे आड़े टेढ़े तिरछे हैं, तभी भी आप यूज कर सकते हो. सो लाइक इन कट्स, लैसरेटेड, रैग्ड और सप्यूरेटिंग वुंड्स. सप्यूरेटिंग मतलब जहाँ पे इन्फेक्शन चालू हो गया है, इट हैज बिकम इन्फेक्टिव वुंड. हेमरेजेस इन स्कैल्प वुंड्स और आफ्टर ड्रॉइंग टीथ, मतलब अभी कोई डेंटल ट्रॉमा हो गया है उसके बाद, एंड इट प्रिवेंट्स फर्दर पस फॉर्मेशन. ठीक है, दैट इज इट, दैट इज द ओनली थिंग important to be remembered. Then echinacea, further you go ahead. What is important to be remembered here is echinacea is also like you had in hypericum, used in case of crushed injuries. However, यहाँ पे you will have injuries like even snake bites, you will have injuries like bee stings वगैरह वगैरह. So it is also said to be a corrector of blood dyscrasia, मतलब सेप्टिसीमिया को ये करेक्ट करने वाला भी है, acute auto infections भी करेक्ट करता है, and it prevents the gangrene or tendency to malignancy in acute and subacute disorders, blood disorders. So in this case, जहाँ पे कैलेंडुला में पस डिस्चार्ज चालू हो गया था, यहाँ पे ये बहुत ज़्यादा सेप्सिस होने लगा है, and the discharge now becomes very foul, and it further leads to emaciation and debility. ठीक है. So you will encounter this to be of great use in puperal infections or venom infections, and in last stages of CA जहाँ पे infection pains बहुत ज़्यादा होते हैं, infection septicemia spread हो गया है, so on and so forth. So I spoke about some important remedies like arnica, ledum, and Belispar. I also spoke about remedies like calendula, echinacea, and hypericum. Right? I hope you have taken the notes. I hope so. If you haven't taken the notes, not to worry. Rewind and play to karo hi definitely, but niche I have attached a link to the PDF. Go download it. It will prevent much of your work, right? And if you really enjoyed learning something from this video, go ahead, share with your friends who you think might benefit by learning theraps of wounds and injuries. और इम्पॉर्टेंट चीज़ और एक, अब ये इंजरीज एंड वुंड्स के थेरेप्स तो आपने पढ़ लिए, ये थियोरेटिकल नहीं है, ओनली थियोरेटिकल नहीं है, प्रैक्टिकली भी आप ट्राई करके देखना। हर एक ड्रग को 30 या 200 पोटेंसी में अपने घर पे रखना, 1 ग्राम 2 ग्राम की बॉटल में, एंड इन केस इफ यू एनकाउंटर एनी सच थिंग, please, any such condition which is mentioned in the therapy, at least try giving it. See for yourself and you will enjoy to see how beautifully homeopathy works, right? So how did you like it? What did you learn? Tell me in your comments below. I'll be eagerly waiting to know आपको next topic कौन सा चाहिए, ठीक है? Hope you enjoyed. Like and subscribe and share. Remember, sharing is caring, right? Okay, see you in the next video. Bye.